It's been the hugest year ever, particularly in type 2 diabetes, but I will also say in type 1 diabetes. This is a year where we've actually had 2 new insulins on the market. For example, one is inhaled insulin, that's known as Afrezza, and the second is another drug by Sanofi, whether this be by Fluke, Fate, or Fortune. The long-acting insulin Lantus was reformulated and is more concentrated, and in doing so it has a longer duration of action and less nocturnal hypoglycemia. So for me, these are 2 very exciting therapies. We also have 4 in total 4 GLP-1 therapies. We have 3 SGLT2 therapies. We have new combination therapies. So in terms of diabetes, this has been a home run year. Most of these are copycats, but the inhaled insulin is a pretty new kid on the block. I think particularly for type 1 patients who don't have a lot of options. It's a very small device, and this could bring a kind of a new approach to treatment. Also, those patients who are a little afraid of having injections. It doesn't mean you don't need a long-acting insulin, but this is a new short-acting insulin that would replace mealtime injections. I think the doctors are seeing more diabetes. They're seeing it at younger ages. They're seeing it at older ages. And they're also being bombarded with new therapies. I've never seen more therapies out there. This year, every lecture I have given or gone to, the big thing has been the ominous octet, which refers to all the different organs that diabetes impacts. And I think it's just the tip of the iceberg. We now have about 8 new therapies, so we're referring to the ominous octet, but I see diabetes, whether we're talking about type 1 or type 2, as really a systemic tsunami. And I am very optimistic about the future with new beta regeneration drugs that will really address the one true cause of diabetes, which is lack of insulin-producing cells. Here at the ACE meeting, we've had some pretty exciting talks on the bionic pancreas, and that is fascinating. It definitely works. It's using 2 insulin pumps, one with the hormone insulin, but the other with a hormone called glucagon from the alpha cells. And at this juncture, that is not available for use, so there are some obstacles, but this absolutely works. And what's fascinating about the bionic pancreas is all you plug in is the patient's weight, and the patient doesn't have to do a thing. It's my hope that this can be commercialized, but we're talking about 2 insulin pumps, a sensor, a computer program, a drug that isn't even on the market. And I feel it's fabulous, but is it going to be able to be available to the large majority of type 1 patients? I don't know. Will be, can patients be or really get these fabulous, the new therapies? Will the bionic pancreas be available? How hard will it be for patients to use 2 pumps, a sensor, an iPhone? But once it's on, you really have a fabulous intervention like no other, especially since you can live your life and not do anything. And until we have a cure, which I believe is imminent. I believe that there is some very new therapy based on the human genome, which will enable us to transform your own progenitor cells within your pancreas into new islets, which contain new populations of beta cells. So I'm very optimistic about the present year and the future.